friends, and thank you for tuning in to another Optimal Health program. I hope you're doing well today. Our podcast will cover a lot of ground today. As you might be able to see, I have articles and papers all over the desk, which is typical for me. Stack things all over the place, and well, I know where everything is, but we're going to go through some great studies on Epstein-Barr virus and the fact that it is a virus that people can carry their entire lives. Typically, people think of it as a fatigue virus when you're a kid and nothing more than that. But I'm going to talk about some really important and scary literature about Epstein-Barr. It's a major cause of fatigue and contributes to other diseases. We'll talk about how herpes virus in the same family of Epstein-Barr can fuel Alzheimer's disease and neurologic issues. And I'd be willing to bet when we talk about that, the same mechanism will occur with Epstein-Barr because it is linked with Alzheimer's, Parkinson's, MS, and a variety of things, but we'll go through that. Projections in one study showing Parkinson's disease cases will reach 25 million by 2050, which is horrendous. Info about a groundbreaking scanner helping to revolutionize breast cancer diagnosis and treatment, a new offshoot of an MRI that allows us to see better and deeper and to see whether spread has occurred better than just the MRI alone would tell us. How aspirin may help prevent cancer by stimulating the immune system. And lycopene in tomatoes, of course, may help to decrease your cancer risk. Yet another study on intermittent fasting helps to cut heart attack risk by preventing dangerous blood clots. So really cool info here. Get your pen and your pad ready. We'll give out citations and things, and we'll take your calls in a few moments here. 888-420-9272. 888-420-9272. Of course, we would love to hear from you through text or email or whichever mechanism you could reach us. This is a live program, as all of my programs are. We're over 30 programs now and marching strong. Excited. Tomorrow, we're going to interview a patient who had ulcerative colitis. Horrible story until we met, set him up, did stem cells, and within a day or so after doing the stem, his picture started to change radically and has not had all of those major problems he had for 21 years before. So it'll be a great program to listen to. That's on 2:30 tomorrow here at the amazing, where are we? At the amazing Long Island
Super
Studio, yeah. Super studio here. We don't give out the location because the paparazzi, of course, are a big pain in the rear end. So we don't want to be hit by paparazzi, people signing autographs. It's a lot.
It's a security.
So it's a high security facility. Nobody knows where it is.
SEAL team members as our security. So don't
you
try.
have to have very, very high ranking ability or clearance to be able to get anywhere near this facility. So once again, phone lines are open, 888-420-9272. Garden City office is 516-794-0404. Thank you for so many emails and calls to the office. We had 5 consults Thursday, which kept me on my toes, kept us busy. And it's amazing to see how many people are super, super interested in learning about their bodies, much more so now than ever before. And I've been a physician for 39 years. Although it doesn't really seem so sometimes, and it seems every minute of it other times. But it's so great to have people come in and ask and learn and want. And some people bring in articles. I found this article. Can we talk about this or that? That's what my whole approach is. To learn as much as we can about you. So it's terrific to be able to see people have this renewed interest. So
we have
somebody there.
We had a phone call. It has ended, unfortunately. Maybe they'll call back.
Okay, well, we're here. You can call back at any time through however much time we're going to spend here today.
Go.
Yes.
All right.
Hi there. How are you?
Hello.
Yes.
Good. How are you?
Great.
My name is Denise, and I'm calling. I have an 86-year-old mother
Okay.
with a bad shoulder. She has had, it wasn't reconstruction, but they put some pins in. It was a rotacuff.
Okay.
This is years ago.
Mm-hmm.
And she, still wear and tear on it, and it's, I'm sure, in bad shape.
Okay.
Sometimes it's just numb, or she's recently gotten a cortisone shot. It's better. But I'm wondering, because she's not able to get another surgery because of her age and whatnot, is stem cells something that would help with that?
Sure. Stem cells are a wonderful mechanism to create repair. And, looking at the MRI showing us where the damage is, if it's a rotator cuff, it's supraspinatus, infraspinatus tendon, labrum, etc., we'll get an idea as to where the damage is and then put stem cells right to that spot. Some people think that as you get older, stem cells are not as, quote, viable. That's the lie that other people that are trying to sell you stem cell from umbilical cord or amniotic fluid, which the FDA and the government doesn't like at all. That's not allowed here because there's too much variability on source and you don't know what you're really getting. They say, oh, your stem cells are too old. So in the past, we've treated 80, 90-year-old people. I treated a woman who is 100 years old because she wanted to get improvement in her vision. And just yesterday, treated my mom, and mom's 95. And she's going strong as possible as can be. So she's doing brilliantly, wonderfully. She's riding her bike every day. And first we started her at 20 minutes, then 25. And last week she called and said she was watching an old movie and was on it for 57 minutes. So you can't give up and think, well, I'm this age, I'm that age, and I shouldn't be doing this or that. Of course, if you medically can, and this is what we want to try to do, we want to get you more functional. So we certainly can do stem cells into the joint to create some repair. So that would make a great deal of sense. There's no risk.
How long a process is that? Does that take weeks? Does that take
No,
a day?
Typically, as you'd expect, you come in, you do a consult. We have some openings, every Tuesday, Wednesday, Thursday, Saturday, so we can try to get people to come in if they want to come in quickly.
No, I mean for the actual process.
Yeah, I'm going to explain that.
I'm sorry.
So we examine you, I see what your MRI shows, look at the entire picture, the joint or whatever, issue we're talking about, get blood work done. In 5 days, the blood work's back. We sit down and go over that and then put together recommendations. So from the first visit to the time that you do STEM, which could be the second or third visit, it's not much. The whole procedure takes less than an hour. So specifically, step by step, the patient comes in, we lie them down on their belly on the table, lift their shirt up a little bit, pull their pants down a little bit, till we get to the crest of the ilium, which is this area here, if we can zoom in and see that. So this is your spine, this is your sacrum, the yellow-orange triangular bone there. The crest of the ilium is here, and it ends in a big fat bump down towards the bottom. So we're not going into your spine, we're not going to your hip socket, we're going to the ilium. We sterilize and numb the area, and through a little pinhole, we extract 60 cc's of fluid, which takes a minute and a half. So that's the extraction. Then you sit and lay down there on the table and wait about a half hour where we spin it in a high-speed centrifuge. In that centrifuge, which is required, a 4,000 RPM centrifuge, we're separating red blood cells, then plasma, then stem. We take the stem from the bottom and then put them either into a joint, IV nebulizer for bad lungs, IV nasal for brain or eyes. So, that all takes, a little bit less than an hour. If we're doing an IV, it takes 10 minutes extra. If we're doing nasal droplet, another 10 minutes. So it's within that realm of time. So it doesn't take long.
Okay. And are there any risks?
They're your cells. So I've told thousands of people that we've treated, there's no risk with your cells because we're taking them out, spinning them, and putting them back in. There's nothing else we have to do to them. They're perfect the way they are. So there's no drug that's used for it, or around it other than numbing your skin with a little bit of the lidocaine. What was your question?
Right. I meant with the injection itself in the spinal area.
No. Well, it's shoulder. So, if we're injecting it around the shoulder, it's usually I treat the front, the side, and the back of the shoulder. It's just covering those different areas. Let's say, for sake of discussion, a person has a little bit of a tear where the biceps tendon attaches to the bone. So that typically would be in the front. If you hold your hand and your arm, bent a little bit away from your body, it's easy to see and feel the biceps tendon. Of course, it's very easy to see that on the MRI. And then so holding that position, palpating, and then injecting right there, it takes a moment to do. So, we're injecting a couple of different spots depending upon the MRI description.
And where you extract the cells, that's also safe?
Of course. Yeah, it's a pinhole that goes right into the crest of the ilium, that fat little bone towards the end of that crest. So, yeah, I mean, there's research on stem cell therapy going back forever. I mean, the term stem cell therapy is 160 some odd years old. A Dr. Haeckel was the first person to call it a stem cell in Germany, and then a Dr. Boveri was the one to start up, applying it to looking at how it helps to repair other organs. Every country in the world does it. So it's been around for a very long time, and many, 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 many thousands, maybe more than that, have been treated over so many years. So it's the one mechanism that's ultimately safe.
It's funny because, I've heard about stem cells for, quite a while, but you don't really hear about a lot of people. I don't know. I don't hear, other than hearing your show, which I've been listening to, and it's very interesting.
Thank you.
I don't know. I just don't hear a lot of people. Maybe I just don't know a lot of people that have.
When people comment on stem cell, and you randomly ask any number of people, and people ask me this every time I go out to dinner or anywhere I am, and someone finds out that I do stem cell. Oh, George Bush made it illegal. That's kind of the buzz term that everybody pops up with. And the reality is that Bush maintained a policy of not using aborted fetal stem cells because nobody wants to make an industry out of aborted fetal tissue to use for stem cell. Besides the fact that if you're using someone's umbilical cord, amniotic, or aborted fetal tissue, it's foreign. Your body could or would reject it. You don't know the genetics of the donor. Like if you're getting umbilical cord from Mexico, Panama, Costa Rica, you don't know the donor. You don't know the infection history. You don't know the genetic issues. Nothing about that. Viruses, heavy metals. They're not going to do a genetic test on a donor cord to see if a person's got a genetic issue because that's a $5,000 to $7,000 test in most cases. So you're just getting stuff, putting it in your body, and you don't know how old it is. You don't know how many cells you're getting that are viable, how many die when it's frozen, how long is it frozen. So all this information you aren't getting, prevent that from being a supported mechanism. And there are companies that are going to try to sell umbilical cord to people and doctors, but those doctors will find out pretty quickly that, if the FDA finds out, you're in big trouble. They closed a guy down in Colorado because he was doing that sort of thing. So it's an unknown. So why take that risk? If you take your own cells out and back in within a half hour, it's brilliant. I think it's one of the most brilliant discoveries, ideas in medicine because it works so well for different degenerative disorders. There's research that shows it decreases the inflammatory cascade of plaque formation in your blood vessels and in your circulation, your heart. So we use it for liver, kidney, heart failure, lupus, rheumatoid, diabetes, MS, Parkinson's, Alzheimer's, stroke, macular degeneration, diabetic retinopathy, COPD. The list goes on and on. Probably a few things I'm
forgetting. One more question.
Yeah.
And I'm sure you've answered this, but, I may have missed it on whatever show. To the, young couples having children, are they able to bank their...
obviously, when you have a baby, you bank that. It can only be used for the baby down the road if they end up having a medical issue or a cancer. You can't use that for anybody else.
I see.
Yeah. So when you're talking about super viable, awesome, perfectly for your body, same language as all your other cells, stem cells, it's your own cells, a minute and a half to extract, once we numb and sterilize, and put back in. Makes all the sense in the world.
If some people, as you were explaining, you don't know where the fetal stem cells were coming from, why aren't your own able to, would a parent use, why wouldn't they be able to use their child's stem cell?
That's a circumstance for, the powers that be. Should it be done? It's probably a decent idea. I just don't know how well it'll work or translate compared to using your own cells. So that's why all the research on your own stem cells from your fat originally, and then bone marrow, which gives you way more stem cells than the fat procedure, because fat is a liposuction, creates black and blue discomfort. There's a little bit more of an issue with that. And you're not getting anywhere near as many cells as when you do bone marrow. Bone marrow has just skyrocketed to the forefront and has been the best source without any risk reservation, no downside. So it's all benefit and no drawback.
Gotcha. I just thought it was a younger, more viable.
Well, think of it. Most people will say that. Well, why would you want to use older cells? Those cells divide all the time. So your stem cells aren't, if you're 30, 40, 50, 60, 70, 80 years old, they divide all the time. And the proof of that, too, is that when we extract the stem cells from the bone marrow, within a week, those cells' numbers are back to normal because they're growing that fast. So when you put them in, they grow. And again, we've had, most of my patients are not 20, 30-year-old kids or adults. You know, they're 50, 60, 70, 80, 90 or so year old people, and they get results. And you certainly could look at those people, talk about their benefits on the website. We have a lot of videos there. I think there are 20 of them, drcalapai.com. So, yeah, we can prove it all day long. One more comment about fat. Excuse me?
I appreciate
thank you.
Your time.
One more comment about fat stem cells from your body compared to bone marrow. Years ago, when I started clinical trial, fat cells were being studied. So, you know, we did some lipo. People wanted to have every speck of fat taken from their body, which you really can't do. It might be risky. But your own fat cells don't have as many stem cells as your bone marrow. So the better mechanism, and it may be 10 or 20 or 100-fold, maybe more than that, you're getting from bone marrow. Interesting that the FDA at one point sued a doctor in California named Berman. He's a plastic surgeon doing fat stem cells. And they said that because he was using collagenase, a naturally occurring enzyme, to help to break down the fat and get more stem cells from it, like getting more marbles out of a thick jelly, substance, you're getting more stem cells out. The FDA was claiming that that's turning the stem cell into a drug. What does that tell you? That the drug companies obviously are going to do everything they can to try to take over stem cells and control it for themselves like they do everything else. But, fat is and was good. It's just bone marrow, and the results are dramatically different. Look at the videos. You'll be amazed.
That's probably why we're not hearing more about it.
Well, think of it, and I talk about this every day. If a surgeon's going to do a big surgery on you in a hip, a shoulder, a knee, or whatever, and they charge the insurance company a crazy amount of money, they're not going to want to give that up for a procedure like STEM. Right. If a patient's diabetic and they're on 5 meds and soon to be 10 meds, and they're going to get worse with the diabetes and live a shorter life because of that, that's been proven 1,000,000 times over, they want to give up the meds and all of that for doing a stem cell procedure, where our diabetic patients, within 2 to 4 or 5 months or so, become non-diabetic. And you can see the blood sugars drop down because stem cells will find the areas of damage degeneration, go to the spot. If it's your pancreas, set up shop and become pancreas cells that are brand new, wonderful pancreas cells that make insulin. So now you can see how the insulin levels are coming up, sugar's coming down, C-peptide levels are improving, and that's a blood test showing that you're making the insulin. And then people can get off their meds. Amazing but true. So there's a big lobby issue probably against anything that goes against Big Pharma, etc. Yeah. But you already know that.
Yeah. Yes, I do.
So thank God for RFK Jr. I'll say that on every show that I do, I'm going to say thank God for RFK Jr. and the president and all the wonderful people that are pulling together to create some good stuff.
I'm a big fan.
Yep.
Well, thank you again.
Thank you. Great call. Thank you for calling.
Thank you. Take care.
Okay. Bye-bye now. Yeah, so great call. Covered a lot of different parts of that interesting topic.
Oh, yeah.
So we love for people to call in. And,
it's been a while.
Yeah, everybody, and you just see this every day. Nobody wants to get on the phone and have a conversation. And whether it's someone you're chatting with or you're going to have dinner with or you're going to date, it's just click, click, click. Text, quick text.
Keyboard's nice.
And then it's abbreviations. Like, what are these abbreviations? Now you got to go on your phone to look at the abbreviations.
We got some questions in the queue, though.
Yes, sounds good.
So this is from Reddit. My doctor wants me to stay out of the gym for 3 months and stick to low-impact activities, but I don't want to risk losing my muscle mass. I'm having stem cells injected in my spine and my knees. I have a dehydrated disc on my L5-S1.
What reason would they want you not to go to the gym for 3 months? In other words, what was the reason that doctor told you not to do that?
Let's see. See if they're still active.
Yeah, so sometimes people give me the second or third part of the picture, but not the first. All our patients that do STEM, we have them relax a little bit, minimize their activity. Then we have them do a little bit of walking or very, very light,
Maybe it's
comfortable.
I'd imagine it may just be because
A spinal problem?
Right.
Yeah, I don't know. I'd have to understand what the original circumstance is, because we do want people to, at the very least, do some walking to pump a lot of blood around, flooding oxygen, vitamins, minerals, and hormones into all your cells. So, yeah, I'd be curious to understand what the original mechanism is.
Yeah. I'll interject when they respond to that. Oh, yes, spinal problem, they just said.
Yeah, so if there's risk of spinal issue, then you can't do things that hurt your spine. Whether it's a disc issue or herniated or otherwise, doesn't mean you can't use a caliper for your hands to try to keep your forearm and your hand strong, or maybe do a little bit of activity where you can keep your muscles, in a little bit of physical demand. You can't do crazy stuff, but there may be simple things that you can do. But again, I've never examined and I don't know a person's condition. So the light, simple things you might be able to do at home may help to keep your body, doing a little bit better as opposed to completely going into atrophy.
They just updated. They said, any advice on low-impact workouts?
Yeah, again, it depends upon the problem. So if it's a neck problem, a person might be able to sit on a leg extension machine and do leg extensions and curls. They might be able to go up and down on their toes. They might be able to do lightweight but very specific, machines that will just work your biceps or your triceps. So it's not involving your neck per se. I wouldn't do anything that twists or puts your head in jeopardy, but I don't know what sort of physical issues the person has. So the exercise have to be so specific that they're not affecting the injured area in question.
Boom. All right, I'll see if they're still active. But the next one, also from Reddit, I need treatment on both of my knees sooner rather than later.
Yep.
My job requires me on my feet all day, and knees have become painful and problematic. One knee was injured by trauma, and I think the other is a result of overcompensation. Doctors said wear and tear from aging and use. I am looking for effective treatments as well as approximate costs for said treatment. I've done research on DBC and BioX.
So the best mechanism of repair for your body would be your own stem cells by far. There's nothing else that's close. It's been documented. It's been around. The idea's been around for 160 years. Many, and probably hundreds of thousands of people have been treated worldwide. The evidence is there, proof. There's 4 million studies on stem cell therapy, even on one search engine, Scholar Google. We've done it for joints, all the different joints, MS, Parkinson's, Alzheimer's, stroke, colitis, you name the degenerative disease. And that just goes to show you that it works for even worse scenarios than what most people have within the wear and tear of their joints. So your joints are made up of your cells. If we take your cells from the crest of the ilium and put them there, those cells will do their job, and that's go to create brand new cells and repair where the damage is. That is by far the best. PRP is not even close. Any other mechanism, laser otherwise, is not going to grow tissue. But this has been proven that stem cells grow tissue. So you certainly can take a look at the videos on my website, drcalapai.com. You can go on Google Scholar and look at stem cell therapy for individual joints or all the diseases I just mentioned. The literature is there. The cost of stem cell varies worldwide. And if you look at, I say this all the time, Mexico, Panama, Costa Rica, you're not getting your own cells, you're getting someone's umbilical cord. And the problem therein, as I mention all the time, you don't know the genetics or the infection history. You don't know anything about the donor. How long are the cells kept? How many die when they're frozen? What are you really getting when you get that? Who's in the chain of command for those cells? Again, how old are they? You just don't know. And they're just sitting there frozen for who knows what period of time. They charge somewhere between $30,000 to $60,000 in Mexico, Panama, Costa Rica for someone else's cord cells, which I think is criminal. The problem beyond what I've just mentioned is that what are they paying someone for that umbilical cord? Or are they cutting it into pieces and charging 10 people for a little bit of the cord? It's just an unknown. And that's why the government, the FDA, doesn't approve of that. Your own cells, their only job is to go where the damage is, and they're out and back in your body within a half hour. Takes a minute and a half to extract, spin for a half hour, then put them back into your system. And people get terrific results. There's no downside, no risk, no side effect. When I first got my fellowship certification, the company that I trained with, which trained a bunch of doctors, their fees are somewhere between $12,000 to $15,000, but there was no better rate for just doing a wrist or an elbow. So I was able to negotiate that company down. One joint ends up being about $5,000, 2 joints. The second one we were able to discount to $2,500. Intravenous going to all your organs was cut in half down to $7,500. Doing a nasal droplet or a nebulizer, adding to lung or nasal, for brain and for lung after the IV is $2,500 on top of the IV, which is again $7,500. So it ranges from $5,000 to $10,000 depending upon what your needs are. So that's the least cost of stem cells in the world. Nowhere in the world they charge $5,000 for stem cell. Nowhere.
All right. Next, moving to TikTok. I've been suffering from back pain for a couple years now. I'm a 24-year-old veteran, and service was not kind to me. Mm-hmm. I have degenerative disc disease, bulging discs, and canal stenosis, all in my thoracic, thank you, spine. After physical therapy, seeing a chiropractor, and receiving steroid injections, nothing can stop the pain. My arms tingle when I lay down. I feel extremely weak and can't lift much. Sitting down for too long is hell, and I can't fall asleep. It's taken a toll on me, to say the least. I'm optimistic about stem cells and what they can do for me.
Well, we certainly need to look at the MRI of the area so we can see specifically what's occurring there. Adjustments, and I'm an osteopathic physician, so we invented osteopathic manipulation, and chiropractic evolved a few years after that, I think 60 or so, 80 years after that. But that's just a temporary way to take some pressure off. But massage will soften muscle and take some spasm away, but that spasm and poor positioning can come back. So that's why adjustments are temporary. Injections with steroids help to decrease the inflammatory cascade, but they're not creating strength or stability. For those individuals that have had issues where we've injected the sacroiliac ligaments throughout the low back and the lumbar area, or we've injected ligaments around either side of thoracic or cervical, have had benefit because you're creating strength in those tissues that help to hold the vertebrae in better position. If you have stenosis that's foraminal, that's where the nerve roots come out off of the spine, and that could be because the disc is compressed and now the bones are getting closer together. We have to see the severity of that. If it's really severe and there's no wiggle room for that nerve, the surgeons may go in and just cut away, shave away some of the bones so there's more room for that nerve to exist. If it's central stenosis, where it's as the cord goes all the way down through your vertebrae and arthritic change has overgrown and you're pressing inside on the cord itself, then that might need a surgical procedure to help to decrease some of that pressure on the cord, but I would need to see that. Traction's a great idea. Massage is a great idea. Again, I'm flying blind with just some of the information that you told me, but I think letting me take a look at the MRIs would give me a much better picture.
Yeah, we'll see if they're they're obviously, it's like a 10-15 second delay, so we'll see.
I have to comment on this for a second. We have patients who've called the office or emailed the office. One patient emailed and said, I have this or that, will this work? And I say, well, you have hip pain. I don't know the full extent of your hip pain. Is there arthritis of the bone? Is there a tear of the cartilage? Is it mild, medium, or severe? I need to look at the MRI and examine the person. So it's not a yes or no answer. When a person says, I have this, I need to define that. And that's why we sit down and we go over a person's history, go through the entire thing, the consult, bring copies of the MRI, so I could make the best statement I can. Without that, I don't know what to tell people that say, I have this or that. What do? I need to understand the entire picture.
All right. This is Instagram. Is it possible to reverse allergies?
Allergies are a very common mechanism, and for the majority of patients I've seen over many years, if you're allergic to a food and we take those foods out, you could absolutely reverse the symptoms created by those foods if you take them out of the picture, because then the antibodies waiting for those foods can't bind, and create that inflammatory cascade wherever they go all over your body. For trees, grasses, weeds, and molds, there's a mechanism that we use to skin test to find where your body first starts to react to an allergen. That's what we call a threshold. So we use very, very weak dilutions of allergy liquid, and we'll find some negative skin test. And then when we start to see the first positive skin test, that means that's the dose your body's reacting to. We can either give you an allergy treatment, which are shots, which gives you a tiny dose of that allergen liquid, but below your threshold, so your body gets used to it. It's not provoked by it because it's below your threshold. Then as we raise that dose week to week, your threshold goes higher and you become less reactive. We also might be able to use drops under your tongue instead of the shots to do the desensitization. So yes, you can change the mechanism. For people who are allergic to food, it can work in two different ways. If you take the food out for a month or 2 months and you bring it in once a week, one food at a time, if you have no reaction, you should be able to have that food twice a week. If you bring that food back in and you react again, then we got to keep that food out for a very long time because that may be more of a fixed allergy than what I might call a cyclic allergy, where you can have it now and then, but not too much. And people that have food allergies also have environmental allergies. One of the weird things we see is that people who are allergic to grain and breads have horrible symptoms in the summer when ragweed's out, because ragweed and the grains are in the same family. So it's kind of a double whammy. You're getting irritated by both. But, your testing will give us that perfect look at what your body's, going through.
Very interesting. This is just a side note, but am I wrong, or are these the allergy seasons, they're just getting bigger and bigger?
Yeah, so it's the cyclic nature and the spiral nature of allergens in the environment has gone up and up and up and up over time. I think many years ago, when there were colder winters and potentially more snow, you really kind of shut down the growing season of trees, grasses, weeds, molds, etc. But we're seeing more people react longer into seasons. We're seeing grasses, trees, and weeds, etc., continue to persist. And if you look at the allergy counts, which is a estimate, on some of the news outlets, you'll see the counts are high, and they're higher than they were before. So we have more people coming in with environmental allergy issues and reactions, still very treatable. In a perfect world, if people have bad allergies in the spring, you want to get them in now so we can test and start the desensitization so that you'll raise your threshold before the season starts to drive you crazy. So it's still very treatable. But yes, the allergy, counts are high.
We got a Rumble chatter saying they're spraying the skies again.
Well, they've been spraying the skies for a long time, and as much as people don't want to think about this, there are a couple of states in the South that have outlawed the spraying because who knows what they're putting up there.
Not New York.
Yeah. I see some of these things where they believe there's aluminum and all sorts of chemicals in it. You used to sound like you're crazy when you say these things, but when legislation for states say they will not allow the spraying, who knows what's there, what we're getting.
Yeah, I had a friend from college, and he, sent in the group chat to all the boys. He goes, guys, explain this. And he legitimately, went to his car windshield and he scraped, the green kind of dust over it. And then he took a magnet and he goes over it. And it was like a quarter of it got picked up by the magnet. He's like,
it's
guys. I'm like, oh no.
I think this is the age of enlightenment now. We're getting to learn about what's going on, where our tax dollars are being sent, and I'm furious about that. Everyone should be furious about that. We're not taking care of people here in the country, in Flint, Michigan, with the water issues and the Detroit and the crime and Chicago. I don't want to go into all that because I'll get upset. But we're learning about all the bad things that are in the foods in this country that the same manufacturers don't put in foods for Europe. It's just unbelievable. So we're going to see that the cloud seeding and all this other stuff is going to be bad. And I think that's also why people have a lot more heavy metals than we're seeing before. But we're going to learn. Just learn. And then you make your best decisions on your health based upon that.
Boom. All right. I'm just going to put up the phone number if anyone wants to call in.
Okay, let's go to some of these cool articles here. Let's talk about Epstein-Barr virus first. Everyone's heard about Epstein-Barr. Everyone's been exposed, probably 90%, I think 95% of the world, as these studies talk about. It's a fatigue virus in many cases. When kids get up between kindergarten and college, which is the most common time to pick it up, it can make you feel exhausted, sore throat, swollen glands, big tonsils. You're home from school for a couple of weeks. It could also make your spleen swell if it's a bad case or if your immune system's weak. I'm just going to read through some of this because it's important to talk about. There are people that develop cancers from Epstein-Barr virus. Probably 24 different cancers: Burkitt's lymphoma, head and neck cancers, breast cancer. The list goes on and on. We'll go through that in a second. Hodgkin's lymphoma, leiomyosarcomas, gastric cancer. So Epstein-Barr uses its viral proteins to mimic growth factors, transcription factors, and they help to control the cellular pathways to keep it going. Epstein-Barr contains a DNA core surrounded by an icosahedral nucleocapsid. Not that that makes any sense to you, but it protects itself, so it's harder for your body to knock it down. It's in the same family as cytomegalovirus and all the herpes viruses. Nasopharyngeal cancer, Hodgkin's, non-Hodgkin's, the list goes on. It also causes MS and lupus. There's correlation there. And there's another study that I'm going to show talks about it correlating with Alzheimer's, Parkinson's, myelitis, encephalitis, all sorts of other neurologic issues. Now here, this is important. 90% of the world's population has been exposed. Upon infection, the individual remains a lifelong carrier of the virus. We know what carrier means. The bug is there. And you may be able to pass it to somebody else. So you're not going to hear this on the news, in regular media. And I'm being kind because I don't want to say the other word for the media. But this bug can wax and wane. It can multiply and make you feel horrible. It can seem like it's gone away, and it still can be there even though your blood test may not show it being a full-blown brand new exposure. It doesn't have to be a full-blown brand new exposure for you to have problems with it. So it typically starts, gets into your throat, the oropharynx, hits your immune cells, your B lymphocytes, goes into your nodes, carries throughout your body. Different B cells, T cells can be affected. Let's see what else we have here. A second page. As you can see, I love doing this stuff. I love getting on the computer and being Inspector Clouseau.
It's so interesting that you're saying all this.
Sleuth.
Because when I was in high school, I got it, and then when
Everybody
I was
does.
sick, I gave it to my mother. Got sick, but she didn't think anything of it.
And you could get it recurrently if your body's weak.
Right, and that's what happened to her. She goes to the doctor maybe 8 years later, a couple years ago, and they're like getting all this blood test. Like, yeah, it's Epstein-Barr.
It can
you got
come
it from
back
your son.
whenever it wants. That's why we test so many people. Some people come in full-blown exhaustion. Yeah, obviously we test. Some people come in a little tired. We still test. It's a simple test. There's 4 antibody tests. So in most people, we see 3 antibodies positive, which means a reactivation. So here it talks about Alzheimer's, Parkinson's, MS, acute cerebellar ataxia, meningitis, acute disseminated encephalomyelitis, brain tumors, etc. And EBV1, EBV2, these are different components of the bug. Also that there are different 6 nuclear antigens that are parts of the bug that, in research they test for. You can't get those tests done in regular labs. Regular labs that doctors use will test, cholesterol, triglycerides, protein, thyroid, all the things that doctors always order. But they're not going to have these extraneous, very rare tests that doctors don't order. They're not going to buy a machine for $500,000 just to do, testing that doctors aren't going to order all the time. So LMP1 and LMP2, these are proteins of Epstein-Barr. LMP1 makes your immune system weak, which ensures its survival. And this has been documented. Epstein-Barr crosses the blood-brain barrier, and you could have it affect your brain without having evidence of the blood test showing positive. So the bug can still affect you without those blood tests being active. And we might see people that have 2 antibodies positive for Epstein-Barr. 1 antibody might mean prior exposure, but the reality is if we can see now, the literature says that you could be a lifelong carrier and you got brain fog, it may be from Epstein-Barr, even though the little sample of blood doesn't show all the antibodies in one little 3-second draw for the blood. It reminds me of Lyme disease. There are tons of people, millions of people have Lyme disease all over the country, all over the world. And if you test the bug and the Lyme has only been there for a few weeks, you may not see the antibodies. It's still there. Clinically, you might be able to make the diagnosis, although only 20% of people seem to get the rash, the bullseye rash. It may take months before those antibodies show up for you to test and see that they're there, but you might see only 2 or 3 of them initially, or you're supposed to have 5 IgG and 3 IgM to be positive. Sometimes the bug will get inside your cells and evade your immune response. It's called the S phase. Thank you, Dr. Joe Boriscano, who's probably the greatest Lyme doctor ever. He's the one that wrote all the different recommendations on how to evaluate and treat Lyme disease. Actually, I got to have him on the show. Oh, yeah. I got to remind myself to do that. He's a brilliant lecturer. Be phenomenal on the show.
That'd be a great episode.
I got to call him today.
Oh, yeah.
So you got to remind me. So you can see negative blood tests 5 or 6 times for Lyme, but the clinical picture may be there. When we see that patient, we put them on vitamin recommendations, intravenous vitamins, et cetera. We'll put them on doxycycline, which is a great antibiotic for Lyme, which is one of the first ones that's been used for many years. If you do the blood test after they've been on doxycycline for a couple of weeks, you might see the full-blown bug because now you're killing it and it's more evident on your blood test. So there are a lot of different ways to look at things. So that's why with Epstein-Barr and with Lyme, you have to think outside the box. Being inside the box when you're trying to evaluate a patient and figure out what's going on is not a great place to be. You could have one foot solidly inside the box, but your other foot's got to be out moving around to try to really figure out what's going on. So important.
So we got a question. Just
Yep.
Someone's asking on TikTok, said, "Hey, I've read that Epstein-Barr virus has been linked to autoimmune disease like multiple sclerosis and
Yep.
lupus." Oh, you mentioned that.
Yeah.
How strong is the connection, and should people?
Connection's there, and I just read a dozen other things that it correlates with, including all the cancers, so it's not a good bug. The weird thing is that traditional medicine just kind of says, oh, yeah, Epstein-Barr, you're tired, and they don't get on the computer and look at all this stuff. Anybody could find this. Go to Google Scholar, put up Epstein-Barr virus and neurologic disease, and you'll see the article that I just, quoted from. Look up Epstein-Barr virus and antibody testing. Look up Epstein-Barr virus and each of the different things that I've mentioned, and you'll see it, cancers, et cetera. So because it doesn't receive enough attention, drug companies don't think to make something to kill it. But look at all the problems it causes. It's not a simple bug. Yes, some people get it, they're tired, they feel crappy for a while, and then it may dissipate or go away. Some people it stays for a long time. The longer it stays, potentially the more risk. But it's always amazed me that drug companies haven't thought, hey, this is a bug that 90% of the world is exposed to.
Yeah.
Maybe I shouldn't give them a hint.
You're freaking people out. Someone's just like,
Well,
you're telling me that
is what it is.
Because I had mono when I was 20 means that could be the reason I have brain fog when I'm 45. Are you kidding me?
Well,
People
remember your exposure at 20 could have been your first. Maybe it was your 7th or 3rd. We don't know because we don't have blood testing throughout, every year of your life or whenever you were fatigued, achy, and tired. But it's a bug that comes back because it's passed around by everybody. So if you're 30 or 40 or 50 and you have kids, they're going to be exposed in school. You're going to be exposed at home. And grandma's going to be exposed because when she comes over for dinner and the kids are around, give grandma a big hug and a kiss. Grandma's cooking some good food, family's around. The re-exposure happens all the time. I see it all the time because we test for it every day.
So someone's asking on Instagram, just like, so is there a way to cure it when it comes back?
The word cure is not a true
right.
word in any sense of the word because it would mean like there's never the ability for it to come back. It can come back down the road. My comments are, and we've seen this, and you can look at Google Scholar on this if you look up intravenous vitamin C therapy. There are 1,500,000 somewhat studies on intravenous vitamin C therapy that helps to inhibit Epstein-Barr, helps to kill COVID, helps against shingles, viruses, the herpes virus, which we know is the same family. Intravenous vitamin C has been used as an adjunct therapy to help to kill cancer. So this is the mechanism that we use to help to knock that bug down. And overwhelmingly, people say that they feel better, and we'll keep watching and monitoring them. For some people, it doesn't come back. But if you're exposed again by somebody who's sick or your immune system becomes weak because you're not exercising, taking your vitamins, and doing other good things that keep your body strong, then there's the potential for it to come back. As well, we have people that over all the years I've been in practice that have coughs and colds and flus, and as soon as they get a cold, they call and come in to a couple of vitamin IVs, helps to knock it out. Some people take the antibiotics, some don't. And then those same people will come in once or twice a month in the winter because when they do that, they don't get colds anymore. They'll say, I haven't had a sinus infection since I started doing some of the vitamin IVs intermittently. So we know the results. We know what your body will do. We know the vitamin IVs help to quadruple your killer cells. They bind to free radicals to help to shut down the inflammatory cascade. It's way more complicated than that, but we know how well people do as a result of these recommendations. So, and I could show this and talk about this all day long because over all the years I've been in practice, I'm a physician for 39 years. We have a lot of people, maybe more so, that have Epstein-Barr and have had to deal with it than almost any other thing that we see.
Crazy. So I got a question from Rumble saying, I've been struggling with a mysterious inflammation and fatigue, and I have seen people online say that Epstein-Barr virus can link to thyroid issues like Hashimoto's. Is there any truth to that?
Yeah, so viruses can damage any area of your body, just as I was mentioning before, and you can hear cancer, autoimmune disease, all of this is correlated with Epstein-Barr. There are things called heavy metals that can do similar things, cause autoimmune disease and inflammation. So there's a lot that goes on in your body you would never know about until we started looking at it. So, yes. So, overwhelmingly people talk about the big blood test that I do. It's about 25 pages. We're looking at vitamins, minerals, hormones, 12-part thyroid panel, not just T4 and TSH, because that's not enough to figure out what your thyroid is doing. We look at viruses, Epstein-Barr, CMV, sometimes herpes 6 virus. We'll look at heavy metals, lead, mercury, nickel, cadmium, arsenic, aluminum, that we do through blood, but we also do a urine test for heavy metals where it's 21 metals, and it's a reflection of what's leaking out of storage. So we look at a lot of things, autoimmune markers, so we can get a better handle on exactly why the inflammation is there. Inflammation is a new buzzword, and it's a general term until we say a person has inflammation from a food allergy or from an autoimmune disorder or from heavy metals causing damage in your gut or your eyes. I mean, we have to define it. We can't just use a general word. We have to use specific terminology.
And this is on that similar note, but someone's just asking, are there any natural supplements or diets, lifestyle changes that could help?
Well, in a general way, yeah, diets and lifestyle changes are good for your body in a variety of ways. We spoke about intermittent fasting initially in the program, talking about decreasing, your clotting risk and decreased risk of heart attack. So that's one simple comment. But think about looking at your blood test and correcting all your vitamins, all your minerals, all your hormones, eating right, doing exercise every day. This can make your body stronger and much more capable to fight infection, decrease cardiac risk, cancer risk. So yes, but you have to give me an idea as to the specific problems or issues you're talking about, because I need to underline and know what's happening to allow those things to occur in your body. Doing the diet, exercise, vitamins, and minerals will not correct everything, but it's a great foundation to have so your body stays strong and healthy.
Crazy. Okay. As far as Epstein-Barr, I don't have any other questions, but I do have some others.
Yeah, any questions are good.
Yeah, so this is totally a different topic, but I've read that bad posture interferes with overall health. Is that true? Does it affect lymphatic drainage?
To some extent, yeah. So bad posture is changing the positioning of your body, your vertebrae, and people should be in a sort of a military position straight up and down when they walk or they stand or they sit. Some people aren't. Will that affect blood flow and lymph flow? To some extent. As you get older, lymph flow changes. And even people that aren't older will recommend they get massage, which is great for lymph flow, great for stretching out muscles. But you want to try to work to have your best posture so that your body can, work its best. Also, as an osteopathic physician, changes in positioning of your vertebrae and pressure on the disc can hit nerve roots. Those nerve roots go to your skin, your muscles, and your organs. So you can have a somatic or a body issue or a positional issue that could affect the nerve flow to your skin, your muscles, and your organs and have a visceral issue as a result of a back problem. So, yes.
Okay, and we're back. We're back to Epstein-Barr. I've read that some experimental treatments like antiviral medications or immune therapy are being studied for chronic Epstein-Barr virus. Are there any promising new treatments on the horizon?
Nothing yet that's new or promising that has any evidence of making a big difference. The antiviral Valtrex, there's a whole class of antivirals used for herpes, cold sores, genital herpes, shingles, etc. There are occasionally meds that have been used for cytomegalovirus if you had it in your eye drops, but nothing has been able to change that picture. So I've looked at research. I haven't seen anything coming up yet, but I'm sure there are studies being done throughout the world in some of the better research facilities, maybe in Europe, maybe in Japan, but we'll keep abreast of that.
All right. And we have this one. My fiance was diagnosed with ulcerative colitis. In the beginning, it was extremely scary. He lost a ton of weight and felt certain medications altered his mindset. He has successfully been on Humira for 1 year. With that, he'd like to get off the Humira because he doesn't want to take it forever. Do you have any advice on what he should do before he gets off? Example, changing diet, etc.
Yeah, using Humira is changing the symptom. It's not changing the cause, the root of the problem. You can see an amazing video on my website, drcalapai.com, of a gentleman, David. He'll be on the show tomorrow. I spoke with him yesterday. I'm going to call him today and make sure we get the time set for him. 21 years he was miserable and was afraid to go beyond a certain driving distance because afraid he'd have an accident. He would go to his aunt's house, go to a friend's house, and, was very, very unhappy. So he came in, went over everything. We put him on a diet that took out food allergens because we tested him for food allergy. We set him up with STEM, and when we did the STEM, either that same day or the next day, I think it was, he had a completely normal, full, regular bowel movement. And he called me at the office. He was just, going, really, really happy. And I'm like, David, slow down. I got to try to figure out what you're saying. So he said how wonderful he was feeling, and then that's just progressed, and he hasn't had problems since. So his result is spectacular. Weaned down off his meds, so he's able to go and do anything he wants now. Travel. So he's in a whole different world from one IV stem cell. He's come back to do it once or twice more over probably the 6 or 7 years. I think it was 6 years or 7 years ago we did his initial treatment, but he feels wonderful. So stem cell is the ideal because it's shutting down the inflammatory cascade, and it's also making brand new cells where there's damage or degeneration. And again, not to belittle, the food allergy mechanism, because people that have stomach problems of every kind, when we test them via blood and then skin, which is more accurate for food allergy, we take the foods out and you see a pretty dramatic benefit. But not enough to repair the gut. From colitis, that's what the stem cell does.
Crazy. I'm looking forward to that tomorrow. Tune in. 2:30, we believe. Most likely.
Yes.
All right. We have one on iron. 28. I'm trying to get more iron in my diet, but I heard that some foods block iron absorption while others help it. What's the best way to make sure I'm actually... You can't
get enough iron from your diet. And even people eating liver, which I don't recommend because you don't know what you're getting because liver's a big filter for any animal's body and all sorts of bad stuff can get stuck there. Iron oral supplements can be used if there's a slight decrease. Shots can be used and intravenous can be used if there's a really big issue with it. So it depends upon the underlying reason why the iron is so low, but you can't get it from diet. Just like you can't get your vitamins to the range you need from diet. People think drinking milk gives them vitamin D. It's so minuscule, you'll never see your blood test get to the right range. We want your vitamin D to be in the 70 to 80 to 100 range because that's where all the benefits occur for immune response, for bone stability and strength. So, your body has to tell us what's happening, and I say this all day, every day. That's why the blood tells us what's going on. Vitamin C also helps with absorption of iron. So some people that don't take any vitamin C, you start taking vitamin C orally, sometimes do a vitamin C IV, then your ability to absorb iron increases. So there are a lot of different things to talk about. It just depends upon what we see on consultation.
Follow up. I've read some things about synthetic vitamins aren't absorbed as well as natural ones from food. Is there any truth to that?
Natural ones are always the best mechanism. There are synthetic drugs that don't work. There are synthetic drugs that do work. But you want to put the best things into your body that are the most natural that you can. So that's probably the best way to say it. And remember, I can tell you what you're absorbing or not absorbing by looking at your blood test. So if you're taking 10,000 units of vitamin C or milligrams of vitamin C and your levels are low, you're not absorbing it. If you're taking 3,000 of a good source, plant source, can come from rose hips, racerola, and your levels are good, great. So we can determine what you're absorbing and not absorbing based upon your test.
So we have another viewer who's gotten a lot of kidney stones, and they said that they had read that vitamin C, too much vitamin C can cause them.
There's no literature on that at all, and I can tell you we do vitamin IVs for patients with vitamin C for the past 38 years or something. And we've never had a patient with kidney stones, and the vitamin C IVs, start at 25 to 50,000 milligrams, 25 to 50 grams. You couldn't possibly take that in a day, a week, or a month, I guess. And it's just we don't see it. And there's no literature saying vitamin C in any dose causes kidney stones. What do people take for vitamin C dosage? 500 milligrams, 1,000. I may recommend 1,000 3 or 4 times a day, or raise it up a little bit to bowel tolerance if you have a cold or a flu. But I've never seen it. And I've never seen literature that says that. So I just don't believe some of these things that are meant to keep you away from all your vitamins.
Okay, I got this one also, TikTok. I take both iron and calcium supplements. A friend of mine said that they shouldn't be taken together. Is that true, and how should I space them out?
So the human body was not made to separate one thing from another. I mean, if you look back and go way, way back, people got out and foraged and ate, good vegetables and fruits and started killing some animals and ate those animals. So it's not as though it was ever intended to be take this pill here, take this pill there. But your blood test has to dictate to us what you need to take. So whether you're talking about B12, any of the B vitamins, C, beta-carotene, D, A, any of these things, we want to see your blood test, put vitamins together, usually breakfast, lunch, and dinner, and then retest to make sure your vitamins are in the great range.
We're getting a phone call.
Okay, sounded interesting.
Wow, I'm awake. How about you?
So yeah, you want to be able to understand what your needs are, and we might give people iron first thing in the morning because you want to get it in there, or we may give it to people at night so that when they wake up, their vitamins already have been absorbed. Some people do vitamin or iron shots because the oral is not the best route. So it depends on the person's scenario. We have a call.
Hello?
Yeah, hi, how are you? Who's this?
Good, how are you? My name is Rose.
Hey, Rose.
Okay, so long story short, I am 29 years old. I got off my birth control back in September. I was on it for roughly, I'd say, 10 years or so.
Okay.
I found it interesting when I went to my OBGYN that when I mentioned I wanted to get off of the pill that, I've been on for 10 years, that they said you just stop. So obviously I did what my doctor said and I just stopped. And it's been a few months, obviously it's been since September, and my periods are completely irregular. Mm-hmm. Some of them have been 17 days long. Others I don't get for 50 days. Then I'll get one 9 days after. So I guess my question is the blood test that you offer in your office, would mm-hmm. that be able to show me what the hell is going on?
Absolutely, positively, without a doubt. Because we're looking at estrogen, progesterone, all the breakdowns of the 3 different types of estrogen, progesterone, LH, FSH. So when you take birth control, you're using a drug to get your body to think, oh, wow, there's a lot of hormone there, let me stop making it. So it stops making its own. And then when you go off of it, your body says, okay, now what do I do? So it's been told for so long not to do much, so that when you go off of it, your body's going to take a while before it starts to create and make more of those hormones again. For some people, we give them DHEA, adrenal hormone, and DHEA helps to stabilize estrogen progesterone, so that can improve the picture. DHEA also helps women, not as much for men, have a little bit more testosterone on board, which is good for bone strength, stability, muscle benefits, sexual drive and function, ability to burn fat with exercise. So we may need to help to give your body a little bit of a push to start correcting that. IGF-1 is also important. That's the active component of growth hormone. So that helps with sleep, memory, energy, focus, concentration. That also balances out your other hormones. So there are things to do to help you to get you back to where you were before.
Okay, awesome. Thank you
Yeah.
so much.
You're welcome.
I have an appointment coming up soon, so
Oh,
I
great.
will definitely, I'm excited.
Terrific. Look forward to seeing you. Thank you for your call.
All right.
Okay.
Thank you for the,
Bye now. Yeah, there's so many people who have that exact same issue. We see this all the time. Every week, someone's coming in with hormone decline, whether it's a young individual getting off birth control, younger men, older men and women. So it's hormone discussion every day. This also brings me back to a thought that I've had many years ago. A girl that I dated, her dad was married, had a couple of kids, and then, widowed, remarried, had a couple of kids, and with his second wife, he had the girl that I dated. But the first wife had such horrible postpartum depression after delivering the baby, and my comment would be they should have used something to raise up the estrogen and progesterone to get rid of the postpartum depression, anything, DHEA, anything, and she jumped out of the window. But that thing is always stuck in my mind because such a horrible thing occurred because the doctors didn't have either the idea or the understanding or maybe the desire to fix this problem. Anything, maybe a medication, to decrease the depressive mechanism. And it happens. And there's another scenario that brings to mind of a very close friend. But when the hormones, either injectable to get pregnant or not there, you have to put something on board to get them to be okay after you stop that therapy. You have to. And if it happens to one person or two persons, it's too many. And it happens to a lot of people. Okay, let's cover a couple of the articles here, then we'll continue taking your calls here. Intermittent fasting cuts heart attack risks by preventing blood clots. This is really cool. We talk about different diet mechanisms in intermittent fasting. So here, this is a study where they took people and just had them do intermittent fasting every other day. Cool idea. What happened is that when they were checking cardiovascular risk, including platelets and platelet activation, thromboxane, which, is one of the mechanisms that helps to create clotting, they found that people doing the intermittent fasting helped to decrease the clotting because it decreases the platelet activation and the thrombus formation. So when you're intermittent fasting, you're decreasing the potential to develop excess platelets, the thrombus, and clotting. So pretty cool study. The benefit was from something called indole-3 propionic acid that helped to inhibit the platelet aggregation and clotting. So pretty cool stuff. 888-420-9272. If you'd like to call in or contact us, please do so right now. Questions, emails, texts. Another great study of aspirin and helping to prevent cancer spread. This is from the Journal of Nature, a very, very highly regarded, one of the best in the world, peer-reviewed journals. And they talk about how aspirin can decrease the risk of a variety of cancers, including breast, bowel, prostate. University of Cambridge scientists were showing, 90% of cancer deaths occur when cancer spreads to other parts of the body. They break away from the original tumor, satellite cells. And this study talks about the aspirin decreasing thromboxane. And thromboxane is the thing that helps to allow spread for some of these tumors. So aspirin prevents cancer from spreading by decreasing thromboxane and releasing T cells from being suppressed. So this was done in mouse and human studies. That's pretty cool. Just by taking aspirin, you're decreasing some of the spread of the metastasis of cancers. Very cool.
We have a funny question on
Funny questions
TikTok.
are fine.
Advil or Tylenol, Doc? What's the preference?
So it depends upon what you're trying to do. Both can work. In some people, they take Tylenol. It doesn't work at all to relieve pain. Advil sometimes has better anti-inflammatory effect. So, and if you ask, as I do every patient, what works for you when you have pain? Oh, Advil doesn't work for me, but this works. Or this doesn't work for me, or that works. It's really individualized. Some people like Aleve, some people like extra strength Tylenol, some people like Motrin, Naproxen. It could be any number of things. Midol. So it depends upon the person. There are studies, and I wish they were covered by insurance, these genetic studies that talk about medications and how you metabolize them. I'd like to figure out if there's a way to get these done at less cost, because they were costing a lot when they were done before, years ago, 10 years ago, 7 years ago. The genetic test tells us if you should never use a medication because it would harm you, because you can't break it down and it would accumulate. If you should never use a medication because your body won't do anything with it, it won't get metabolized. If you can use something that works for you, that's safe, or something that may interact with other meds, so you have to look at this list to make sure you're not on these other meds. But we're going to work on seeing if we can get some of that testing done. It's genetic medication testing to see what you would or wouldn't be able to use.
All right, got this one. I've been told I might be low on iodine because I don't eat much salt. How important is iodine for thyroid health, and what are the best ways to get it naturally?
Iodine's important. You can get it from taking a supplement. The old way, many years ago, someone was describing iodine and taking some liquid iodine, putting it on your skin, and if the iodine disappeared right away, that means you were low. That's really not scientific. But a lot of people took iodine liquid because of that. I mean, a lot of people need it. It's good within your production of your thyroid. It's part of the process, part of the pathway. So, taking a capsule of iodine might make sense. Some labs will test iodine in your blood, so you could do that. I think it makes sense, especially people that have thyroid issues. So you want to get as much help for the thyroid as you can if your thyroid's out of whack. Interesting study on a groundbreaking new scanner to revolutionize breast cancer diagnosis and treatment. Now, this comes from the University of Aberdeen in UK, United Kingdom. A new test called a field cycling imager, FCI scanner, can examine breast tissue. And it's got a better view from multiple angles than the regular MRI to look at whether the tumor has gone beyond its original spot or space. Currently, 15% of women, probably closer to 50, need a second surgery after lumpectomy because the edges of the tumor may be spreading out a little bit. When you talk about micro spread, you can't see it obviously with the naked eye, and maybe some tests you can't see it, but this test, field cycling imager, derives from MRI. It can work at ultra-low magnetic fields, which means it's capable of seeing how organs affected by disease where you couldn't see it otherwise. The FCI scanner can vary the strength of magnetic field during the scan. It means it acts like multiple scanners in one, can extract multiple different types of information. Bingo. Of course, we may have to wait a little bit before these tests are readily available, but, it's great research. It's certainly in the right area. The British Society of Breast Radiology is one of the ones who published this in the medical journal. So we have to start looking for the fast cycling MRI, FCI. So we're going to keep our eye on that. We'll just look at literature and see when that's going to be available. I think all the MRI facilities are going to jump all over that, because if you could tell people that you've got a much better way to evaluate the cancers, and the doctors are going to want it. So I wouldn't be surprised if oncologists band together and surgeons and buy these machines or set them up in MRI facilities so they could have the ability to really evaluate you and then give you a better outcome. It would be brilliant.
That's crazy.
888-420-9272. If you'd like to call and ask a question, if you have some comments, certainly give us a chat. drcalapai.com, CALAPAI.com is the website. You can email me there.
Nope, never mind. We have a so excited for tomorrow's show. That's what I got.
Awesome.
Not a question, though.
Awesome.
It's going to be a good interview. Oh, Instagram. What peptides do you offer for gallbladder health and intestinal pancreas health, mainly gallbladder?
So there are no peptides that are going to take your gallbladder and make it into a happy little camper. These peptides work in a variety of ways in your body. Like, we talk about NAD all the time, nicotine, adenine dinucleotide. That's great for memory, focus, concentration, word retrieval. It's great for repairing your cells. Literature says it repairs DNA. It's the one primary peptide that takes oxygen through a multi-step pathway to become 36 molecules of ATP, which is energy, which is applicable for every cell of your body. So as much as people want a vitamin for this, a peptide for that, they all work well. It just depends upon what your circumstance is. If a person's got a gallbladder issue, gallstones, if they have too much fat in the diet, that'll overwork the gallbladder because you're supposed to squeeze bile into your intestine to break down fats. It's more than just taking a peptide to see what that may change. There's a lot of talk about BPC 157, which may have some anti-inflammatory effect, but I can't tell you it's going to go right to your pancreas, rather your gallbladder, and change your world. It's not going to do that. We've had tons of people on BPC 157 that come in on it, that I haven't necessarily recommended it for them, that don't see any benefit at all. So things can be hyped in the media and social media, but may not have a bearing because your body didn't have that or require that your whole life. NAD, you've required in every single cell in massive amounts your whole life. So as you get older, you're not making it. That's how your body changes and ages. IGF-1, sermorelin, these are the active components of growth hormone. They're important for hair, skin, nail, sleep, memory, focus, concentration, endurance, strength, exercise capacity, muscle repair and stimulus, bone. So this is important for your whole body. Since you were conceived, IGF-1 is there, growth hormone, to create your height and your bone density and strength and your mass. And basketball players have a ton of it. That's why they're taller, because they grow more before their bones close. But as you get older, you need it there to keep your body functioning as a younger individual. So those are the two most important. Other things may help your immune response somewhat, but you have to be careful that you're not spending time and effort and a ton of money on something that's not going to give you a result. So we look at all of those things, and certainly it gives us a good place to make recommendation once we understand what's going on with your body. Heavy metals can damage all your organs, your pancreas, your brain, so we can't ignore them because they're everywhere. In 39 years of being a physician, when I first started looking at heavy metals, every adult has them, some people more than others. And I used to think that heavy metals were really for people who worked in a factory with metals. No. Yes, of course, if you're a contractor and you're cutting those, aluminum studs that you screw your sheetrock into, you're going to have immediate exposure. If you have fillings in your teeth, you're going to have 50% mercury in the silver fillings of your teeth, and that can stay in your system, get into your blood, go damage your thyroid, autoimmune thyroid disease. Lead, mercury, and cadmium in lipstick and makeup. Look at all the police officers who work in these gun ranges where they're inside, and as soon as you open the door, you smell that lead. These guys have massive exposures to lead. Lead causes damage to the brain, damage to all your heart and all your organs. Arsenic is in chicken, shrimp, rice, apples, California wine, aluminum pots and pans, aluminum foil, antiperspirant, so they're everywhere. We also did a show a while back talking about plastic water bottles that you should never use anyway, but when they heat up, they can emit metals into the water. So you should be using triple reverse osmosis filtration in your home to make sure that if the water coming in is completely devoid of metals and other contaminants. So it takes a little bit of work to understand what you need to do to make your home environment and your own personal environment, super healthy. Last article we'll talk about is tomatoes and lycopene. Lycopene is an important nutrient. It helps to decrease the risk of cancers. People that have lots of tomatoes in their diet have lots of lycopene. A meta-analysis published by the Journals of Frontiers in Nutrition They looked at 121 plus studies, and those people that had the highest amounts of lycopene on board had the lowest risks of cancer by 24% to 35% in some of these cases. So grow your own tomatoes, people. Grow them. Don't buy these perfect-looking things in the store that, are just too good-looking to be true. You can control the environment in the soil in your home, or you can get a planter box, or there are these things that you get above ground that you put a foot or two of dirt in, your best sources of soil and nutrients, and you can grow these things. Some of the places like Hicks Nursery I've gone to for forever, you can get little tomato bushes where you put that pot into the soil in a raised box or in the ground, and it's a bush. It doesn't get more than like 3-4 feet tall, but you get tons of Roma tomatoes, and they're phenomenal. They're awesome. Why not? I mean, you can put these, as I've done, put these boxes on your deck, walk outside the kitchen, sit down, have some tomatoes. I'm trying to figure out how to make a mozzarella bush, to see if I could have the mozzarella and tomatoes together. There's no reason why you can't do that. I put in 5 fig trees a couple of years ago. We get tons of figs. I know my soil is perfect. I have it tested. I'll put in all the organic things, compost, as my dad did for many years, when we were kids. And my mom's listening to the show, so she knows, how we did that over so many years. Had a nice plot. It was probably about 20 feet wide, maybe about 10 feet across. And we grew all sorts of things. And we used to compost and put eggshells and chicken bones and whatever we could, any of the food, into the soil, and made it really dark and fertile. Even threw some multivitamins in there once. I think that made the tomatoes grow really well. But, grow some of your own food. Once again, as Frankie knows, Gardyn, Gardyn, makes a device that has a base, and it's got a couple of the PVC pipes that will have light shine down on these little pods that you put in that are automatically watered with timing, and you're growing your own vegetables inside your house. What's better than that? Genius.
Replace the water every week. It's amazing.
Genius. So you can have, instead of going outside and getting your hands and your knees dirty and doing all that, which I like to do anyway because, it's a genetic thing. Italians, we have to get our hands and knees and feet dirty and come in all sweaty and messed up because we have to feel like we've done something, connect with the earth. Have your vegetables inside your house. It's a genius idea. And you could have that year-round. Another little story about perseverance. Many years ago when I bought my house, and there was a little bit of a metal gate around the lower part of the property near the pool, I'm like, I'm going to go and get a bushwhacker, a weed whacker, an edger, a chainsaw, a bow saw. I bought all sorts of stuff from Home Depot because I bought a house. And now I'm going to take care of it, because it's my land. Of course, watching the TV shows and all these Alaska people going out and doing all this hardcore stuff, you get excited for it. Oh, yeah. I worked all day in one area, and I think I cleared out a 6x6 area of sticker bushes and ash trees that have these long spikes and all these needles on them. You grab them once, you'll never grab it again. But, yeah, it's just, and I had a company come in and do all the work because they just do it better with machines. But at least that day I was, like a man from the Wild West, a man from the frontier. So
back to your roots.
Yeah, back to my roots. So you got to do some of that because it really makes you feel good inside when you're eating your own, vegetables and such. We used to have gatherings when I first moved to the house. I had a very big garden, 60 by 50 feet, rototill, did everything, bought tons of stuff at Hicks. I used to have to go down to the garden with a big canvas bag like you would put fireplace logs in and put tons and tons of vegetables, pick them, bring them, dump them in the sink, and my family would start cooking and making stuff. It was a lot of fun. But you at least have to have a little bit of a garden just to keep your food healthy and pure and safe and organic. Okay, I think we're done with questions, right?
Pretty good.
Calls,
good today. Yeah,
82 minutes.
Not bad.
God.
Back tomorrow.
I think I take after my mother.
She's watching. Relax.
Yep, she's watching. Mom can talk and talk and talk, which I guess I've inherited that from her. It's a good thing. Hey, Ma. Friends, thank you for listening. God bless you all. Have a wonderful day. We'll be back here tomorrow with a great interview, and look forward to chatting with you.